What happens when you can't breathe on your own? Imagine a machine, a mechanical lifesaver, acting as your lungs, moving air in and out, ensuring your body gets the oxygen it needs. This is the reality for many individuals who experience respiratory failure due to various conditions and injuries. This machine, known as a mechanical ventilator, plays a critical role in the world of medicine. Picture a mechanical ventilator acting like bellows, pushing air into your lungs and controlling the frequency and volume of each breath. This process is carefully managed by a team of healthcare professionals, including respiratory therapists and doctors. In some scenarios, a mask is all that's needed to deliver this life-sustaining air from the ventilator into your lungs. But in more serious cases, a breathing tube may be necessary. As your condition improves, the healthcare team will gradually reduce the ventilator support, a process referred to as weaning, until you can breathe independently. Mechanical ventilators are not confined to hospitals. They find their place in ambulances, medevac air transport, and even at home for long-term illnesses, given there is adequate training and resources. However, being on a ventilator is not without risks, such as susceptibility to pneumonia or potential damage to vocal cords. Respiratory failure, the primary reason for needing a ventilator, is a dangerous condition. It's when your organs can't get enough oxygen due to your inability to breathe well. It can also result in a buildup of carbon dioxide, a waste gas, in your blood. Conditions leading to this include acute respiratory distress syndrome, head injuries, stroke, asthma, and many more. Even in surgery, with the administration of general anesthesia, a ventilator may be required. The medicines used can affect your normal breathing pattern, hence, a ventilator assists in controlling your breaths. Now, how does this machine work? Ventilators push air into your airways, the pipes that deliver oxygen-rich air to your lungs during inhalation, and carry out the waste gas, carbon dioxide, during exhalation. The machine can be set to breathe a certain number of times per minute, or to only deliver air when you need assistance. Before you're put on a ventilator, the healthcare team may provide oxygen through a mask, administer medicines to reduce pain and induce sleep, and deliver fluids and other medicines intravenously to maintain oxygen-rich blood flow to your organs. The air from the ventilator is then delivered either through a mask or a breathing tube. To recap, mechanical ventilators serve as an external set of lungs for those who struggle to breathe independently. They're a crucial part of medical practice, used in various settings and for a variety of conditions. They provide life-sustaining oxygen, but they also come with their own set of risks and challenges. The journey of using a ventilator is a collaborative one, with a dedicated healthcare team working tirelessly to improve the patient's respiratory function and ultimately their overall quality of life.